Welcome to the Neuropathy Support Group and Podcast. I'm Chris, and I'm so glad you tuned in. It's my hope with this podcast to help all of us gather information that might help those that need support dealing with this debilitating issue. Hello, and welcome to this podcast. Before we get started, let's get the formalities out of the way with the medical and privacy disclaimer. I am not a doctor or medical professional. The information on this podcast is from personal experiences and is meant for group support. Additionally, the information discussed is not meant to diagnose, treat, or cure any underlying conditions associated with neuropathy. All names here within are private and will not be shared with any outside sources. Please consult your healthcare provider before making any health decisions. If you have medical concerns or an immediate emergency, please contact your doctor or dial 911. Hello everyone, and thank you for joining me today with this podcast. Before we get started with the topic I want to talk about today, I just wanted to let you know that this will be the last episode just for this month. Most of you might already know that I'm going to be moving into a new location, new house, so I need to pack everything up and get it ready to move. So I will start back up again in October, so don't worry, I'm still going to be here, but I just wanted to give everyone a heads up, and I'll also be posting the message in my Facebook page to let all of you know. But again, thank you for all that you do for being here, listening to these podcasts, and I hope that they really help in some kind of way for you. So let's get to today's topic. Today, we're going to be talking about muscle wasting, which is also called muscle atrophy. And we want to know what causes the muscle wasting. And this is a big one for me because I have muscle wasting, and I've noticed that my arms are real small now. And, because I think it's because that we don't use them as much, when we're not using them because we're in so much pain and we don't get a lot of exercise. So let's find out what muscle wasting is to begin with. Muscle atrophy is when muscles waste away. It usually is caused by a lack of physical activity. When the disease or injury makes it difficult or impossible for you to move an arm or leg, the lack of mobility can result in muscle wasting. Over time, without regular movement, your arm and leg can start to appear smaller, but not shorter than the one you're able to move. In some cases, the muscle wasting can be reversed with the proper diet, exercise, and physical therapy. Well, it would be nice if I could exercise and have physical therapy, but those two are out of the option. So here's the symptoms of muscle atrophy. You may have muscle atrophy if one of your arms or legs is noticeably smaller than the other, you're experiencing marked weakness in one limb, and you've been physically inactive for a very long time. And if these are symptoms that you have, call your doctor to schedule a complete medical examination if you believe you may have muscle atrophy, or if you are unable to move normally. You may have an undiagnosed condition that requires treatment. So what are some of the causes of muscle atrophy? Unused muscles can waste away if you're not active. But even after it begins, this type of atrophy can often be reversed with exercise and improved nutrition. Muscle atrophy can also happen if you're bedridden or unable to move certain body parts due to a medical condition. Astronauts, for example, can experience muscle atrophy after a few days of weightlessness. I've heard about that too. I've heard stories of that happening to astronauts. Other causes for muscle atrophy include lack of physical activity for an extended period of time, aging, alcohol-associated myopathy, which is a pain and weakness in muscles due to excessive drinking over long periods of time, burns, injuries such as torn rotator cuff or broken bones, malnutrition, spinal cord or peripheral nerve injuries, stroke, and long-term corticosteroid therapy. So here's some medical conditions which can cause muscles to waste away or can make movement difficult, leading to muscle atrophy, which includes ALS, which is also known as Lou Gehrig's disease, which affects nerve cells that control voluntary muscles movement. Dermatosis causes muscles weakness and skin rash. Guillain-Barré syndrome, an autoimmune condition that leads to nerve inflammation and muscle weakness. Multiple sclerosis is an autoimmune condition in which the body destroys a protective covering of nerves. Muscular dystrophy, an inherited condition that causes muscle weakness. Neuropathy, which is what the big major group is us here today, can cause damage to a nerve or nerve groups resulting in a loss of sensation or function. Osteoarthritis causes reduced motion in the joints. Polio, a viral disease affecting muscle tissue that can lead to paralysis. Polymystosis, an inflammatory disease. Rheumatoid arthritis, a chronic inflammatory autoimmune condition that affects the joints. And finally, spinal muscular atrophy is a condition causing arm and leg muscles to waste away. So how is muscle atrophy diagnosed? If muscle atrophy is caused by another condition, you may need to undergo testing to diagnose the condition. Your doctor will request your complete medical history. You will likely be asked to tell him or tell them about old or recent injuries and previously diagnosed medical conditions, your list of prescriptions, over-the-counter medications, and supplements you're taking, and give a detailed description of your symptoms. Your doctor may also order tests to help with the diagnosis and to rule out certain diseases, such as blood tests, x-rays, MRI, CT scan, nerve conduction studies, muscle or nerve biopsy, and EMG. Your doctor may refer to a specialist depending on the results of these tests. So now let's talk about how muscle atrophy is treated. Treatments will depend on your diagnosis and the severity of your muscle loss. Any underlying medical conditions must be addressed. Common treatments for muscle atrophy include exercise, physical therapy, ultrasound therapy, surgery, and dietary changes. Recommended exercises might include water exercises to help make movement easier. Physical therapists can teach you the correct ways to exercise. They can also move your arms and legs for you if you have trouble moving. Ultrasound therapy is a non-invasive procedure that uses sound waves to aid in healing. If your tendons, ligaments, skin, or muscle are too tight and prevent you from moving, surgery may be necessary. This condition is called contracture deformity. Surgery may be able to correct contractive deformity if your muscle atrophy is due to malnutrition. It may also be able to correct your condition if a torn tendon caused your muscle atrophy. If malnutrition is cause of a muscle atrophy, your doctor may suggest dietary changes or supplements. So as I do my research for these symptoms and other things that we talk about on this podcast, I also go and look for more additional information on other websites. So right now I found another website that talks about other things that can cause this muscle reduce atrophy. So let me talk about this stuff here, and if it does repeat from what I just discussed, I'm sorry. But let's see here. Sorry about that, plane just flew over. So, what else can cause muscle atrophy? Poor nutrition can give rise to numerous health conditions, including muscle atrophy. Specifically, the International Osteoporosis Foundation warns that diets low in lean protein, fruits, and vegetables can lead to reductions in muscle mass. I've never heard that before. Malnutrition related to muscle atrophy may develop as a result of medical conditions that impair the body's ability to absorb nutrients such as irritable bowel syndrome, celiac disease, and cancer. So first, let's talk about age. As a person gets older, their body produces fewer proteins that promote muscle growth. This reduction of available protein causes the muscle cells to shrink. Sorry about that. I don't know what is going on today with these planes flying over. Usually the The planes fly off in a different direction, so they must be doing some test runs for the National Guard here. But let's get back to age here. So, in addition to reduced muscle mass, sarcopenia, I guess is how you say it, can cause the following symptoms: weakness, poor balance, difficulty moving, and lower endurance. A loss of muscle mass may be inevitable results for natural aging process. However, it can decrease the risk of injuries and negatively impact a person's overall quality of life. Another issue may be genetics. Spinal muscular atrophy is a genetic disorder that causes a loss of motor nerves, cells, and muscle atrophy. Muscular dystrophy refers to a group of progressive conditions that cause loss of muscle mass and weakness. So getting back to some of the other topics, which I probably already mentioned, but diseases and chronic conditions that contribute to muscle atrophy include ALS, which I've said, MS, arthritis, and myositis. Now, arthritis refers to inflammation of the joints that causes pain and stiffness. Arthritis can severely limit a person's mobility, which could lead to muscle disuse and atrophy. Myositis. The term myositis refers to inflammation of the muscles. This condition causes muscle weakness and pain. People can develop myositis after viral infection or as a side effect of autoimmune conditions, and also polio. This infectious disease attacks the nervous system. It causes flu-like symptoms and can result in permanent paralysis. Also, you may have neurological problems. So an injury or condition can damage the nerves that control the muscles, resulting in a condition called neurogenic muscle atrophy. When this develops, the muscles stop contracting because they no longer receive signals from the nerves. Here's some symptoms of muscle atrophy. In addition to muscle mass loss, and symptoms of muscle atrophy include having one arm or leg that is noticeably smaller than the others, experiencing weakness in one limb or generally having difficulty balancing, and remaining inactive for an extended period of time. Treatments for muscle atrophy vary depending on the degree of muscle loss and the presence of any other underlying medical conditions. Treating the underlying condition causes that muscle atrophy may help slow down the progression of the muscle loss. Treatments for muscle atrophy include physical therapy. Physical therapy involves performing specific stretches and exercises with the aim of preventing immobility. Physical therapy offers the following benefits to people who have muscle atrophy. It prevents immobility, it increases muscle strength, it improves the circulation, and it reduces spasticity, which causes continuous muscle contraction. Also, some other areas of helping with your neuropathy is a functional electrical stimulation. Functional electrical stimulation is another effective treatment for muscle atrophy. It involves the use of electrical impulses to stimulate muscle contraction in affected muscles. During the FES, a trained technician attaches electrodes to an atrophied limb. The electrodes transmit an electrical current which triggers movement in the limb. Another test would be the focused ultrasound therapy. This technique delivers beams of ultrasound energy to specific areas in the body. The beams stimulate contractions in atrophied muscle tissue. Here's something else that they're working on. It's called focused ultrasound therapy. This technique delivers beams of ultrasound energy to specific areas in the body. The beams stimulate contractions in atrophied muscle tissue. This technology is in the development phase and has not yet entered the clinical trial phase. And finally, the last thing that could probably help you is surgery or surgical procedures may improve muscle function in people with muscle atrophy, which is related to neurological conditions, injuries, or malnutrition. So finally, muscle atrophy or muscle wasting is characterized by significant shortening of the muscle fibers and a loss of overall muscle mass. Several factors can contribute to muscle atrophy, such as remaining immobile for long periods of time due to illness or injury, your age, your malnutrition, genetics, neurological problems, and certain medical conditions such as arthritis, mitosis, ALS, and MS. Now, I keep saying mitosis, it's myositis. So one last thing I want to tell you is what the different types of muscular dystrophy there are, and which each type involving individual loss of strength, increasing disability, and possible deformity may happen. So there's 9 types of different muscular dystrophy. Each type differs the muscle affected, the age of onset, and its rate of progression. Some types are named for that specific muscle. Now, I'm not going to go over all of them because we're a little short on time, but I will make sure that I post this on the Facebook page. But there's a long list. There's one called Becker, there's one that's called distal, and there's one that's called myotonic. And also you may have an issue with swallowing problems. Swallowing problems or difficulties or tiredness interfere with eating. Even with the best attempts of providing nourishment in the hospital, people who have trouble swallowing tend to lose weight. And that seems like a no-brainer. So there's a lot of information on the web, for causes, prevention, reversal for muscle atrophy. So again, I hope this information has helped you. I will make sure that I post all these websites that I found in my web page on Facebook. And that's under Neuropathy Support Group and Podcast. So I hope this time together has given you additional information that you may need to know or want to know about muscle atrophy. You can use this information to diagnose yourself and then take that information to your doctor and let him know how you're feeling. So remember, next week there won't be an episode until October because I'm moving. So I will see you guys all back then. I will keep you posted on my Facebook page where, at what point where am I on the moving part of it, because I still got to set up everything when I get to the other house. Again, I want to thank you very much for being here. As we come to a close, it's my hope this podcast and other sources, such as product reviews that I have discussed today, can better our lives and give us some relief dealing with neuropathy. This episode, plus others, are posted every Monday on Facebook, Twitter, Instagram, iTunes, Spotify, and Stitcher. And finally, whatever life throws at you, even if it hurts you, just be strong and fight through it. Remember, strong walls shake, but never collapse. Talk to you next Monday.